Pneumatic Hand Rehabilitation System, Reha-Pro RL500. This is a rehabilitation device for carpal joints and developed to prevent and treat the joint stiffness or laxity caused by brain injuries, spinal cord injuries, or traumatic injuries. Repetitive exercise using RL500 allows the dysfunctional hand to replace and activate the peripheral nerve tissues and to activate the stiff muscles so that exercise functions can be restored. Reha-Pro has been designed to be portable and comfortable for patients, providing a warm feeling. In addition, the design that maximizes the safety of patients with pneumatic techniques and mechanisms by applying tension and flexible options which can cope with momentary seizures or paralysis which may occur during treatment. Our brain consists of a great many brain cells. Even if a part of brain cells are damaged, they can be replaced by other neighbor cells to recover the functions through repetitive rehabilitation treatments, which is called brain plasticity. Reha-Pro RL500 is a rehabilitation device that recovers the normal brain function based on the principle of brain plasticity. The universal rehabilitation device using torque can cause pain or damage on the treatment part in case sudden cramp or stiffness occurs. Reha-Pro, that improves such problems, innovatively utilizes the soft, safe, and tensional pneumatic system, so the patients can improve their functions in comfort and safety. Reha-Pro RL500 is a rehabilitation system with brand mind motivation. Reha-Pro RL500 allows patients to actively participate in the treatment program together with repetitive rehabilitation exercises, providing the visual stimulants through a display window showing real-time movement, position with animation, and the auditory stimulations through the sound that quickens according to the setting angles. By managing the ID of each patient and the cumulative patient outcome data, the physician can check patients' improvement. First of all, patients can receive confidence and self-motivation for rehabilitation with the improved clinical reports. Reha-Pro was born through several years of development and clinical trials with a collaborative medical team and safety certification from rigorous testing laboratories. Plate slide. Scientific designs that not only extend the size to fit the hands, but also facilitates the stiffness friction that appears on the flexion stage. Universal joint. This is a universal joint that can be worn without any restrictions by degrees and directions of bending. Thus, all patients with any degrees of stiffness can use it. In addition, we have carefully considered the patient's safety so as to alleviate the external impact or momentary stiffness shock. Arm stand. Since the arm stand is designated to rotate 360 degrees, it can be set regardless of the criteria of hand paralysis. Height adjustment valve. A height adjustable valve that can be controlled to fit the patient's height. Reha-Pro RL500 is made up of user interfaces that enhance the convenience of users and patients. There are 3 rehabilitation modes, including the finger mode, the wrist mode, and the dual mode that exercise the wrist and fingers simultaneously. For the carpal and wrist joints of the patients with chronic hemiplegia caused by stroke, the improvement of movement ranges and the amount of muscle tone relief were clinically compared between the experimental group that used Reha-Pro and the control group treated by manual methods of physical therapists. When comparing 2 groups for carpal and wrist joints, the improvement of movement ranges before and after rehabilitation of carpal and wrist joints was similar in both groups, as shown in the graph. Therefore, it has been demonstrated that Reha-Pro has rehabilitation effects, same as the existing manual methods. In particular, the amount of muscle tone relief was dramatically improved in Reha-Pro RL500 than the manual method, which demonstrates that Reha-Pro RL500 is more effective than the manual method in improving stiffness.
시간, 공간 제약 없이 병원뿐 아니라 가정에서도 사용 가능하여 중추신경계 손상 환자들의 수관절 경직과 관절 구축 예방에 큰 도움이 될 것입니다.